Hello. Alopecia areata. This has been in the news of late. Ever since the comedian Chris Rock was slapped by Will Smith in the Oscar ceremony last week. What happened there was Will Smith's wife has alopecia areata and she has lost all her hairs. This was made fun of by this comedian and that angered Will Smith, who went and slapped him. We are not here to discuss why he slapped and all that. We are here to discuss what did that wife have for which fun was made of, and that is the condition called alopecia areata. And to tell you more, this is Dr. Venkataram Mysore, Dermatologist, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Cunningham Road, Bangalore. What is alopecia areata? Alopecia areata is a condition in which the hairs fall off. Roots don't get damaged, but the shaft completely falls off. Why does it happen? It happens because of what is called autoimmunity. What does it mean? Means there is an alteration, derangement in the immune process of the body, with the result that the immune process attacks the hair itself, leading to its loss. There are a number of autoimmune conditions: thyroid problem, certain types of anaemia, rheumatoid arthritis, diabetes. These are all autoimmune diseases. And this alopecia areata can happen in any age. It can happen as small patches when it is called alopecia areata localized type, 1 or 2 patches. And it can happen in a large patches, several large patches. Or very rarely, particularly in children, it happens over the entire scalp. That's called alopecia totalis. And sometimes this alopecia totalis becomes universalis. Eyebrows, moustache, beard, body hair, everything goes. That is alopecia universalis. This condition can happen in some families. It can be familial. It can happen in association with certain other diseases like I mentioned, thyroid, arthritis, lupus, etc. And it can be precipitated by stress. Now, the treatment depends on the severity. If it is 1 or 2 patches, local application of a cream or a steroid injection locally or minoxidil lotion, that is all that is needed. This happens in about 70% of cases. Lesions disappear. This is easy. In another variety, in some cases about 20-30% of cases, the lesions patches become large, and large patches happen here. This needs oral drugs. These drugs include drug called apremilast, sometimes weekly pulse steroid treatment, and sometimes methotrexate, etc. Rarely there is extensive alopecia, very, very large patches, all the hair going, alopecia totalis, universalis. There it needs other types of drugs, immunosuppressants, azathioprine, cyclosporin, or latest drug called JAK inhibitor, tofacitinib. This is a very promising drug, a new drug which works fairly well even in severe cases of alopecia totalis. The treatment can extend up to 6 months or even 1 year. But one positive aspect of this disease is root is never completely irreversibly damaged. It is always possible to get the hair back. So patients should not lose hope. That is very important to understand. Now these patients suffer greatly psychologically. Particularly a woman loses her hair, everybody can understand it's not easy to bear. So they deserve support, they deserve empathy and understanding. So now, another aspect that is important is people do self-treatments or go to quacks. Even barber tells, sir, you got a patch, put some onion juice here, put some lemon juice here, put garlic here. Wrong, it should not be done. People apply tuna, lime. People apply coffee powder and all kinds of stuff. Chili. This will all lead to scarring and it should not be done. So, whenever you notice a patch like this, you should visit your nearest competent dermatologist. Only dermatologists can treat this properly, other specialties cannot. This needs proper knowledge because it is not a very simple thing to treat. It takes a few months to treat. So always contact a dermatologist for treatment of alopecia areata. There is no room for despair, no need to be very depressed about it. There is always a positive message from this about this disease. Roots are never destroyed, they can always come back. Many promising drugs are in the offing. I hope you have liked this video. Please spread this message. If you want us to communicate to you about similar other topics, please let us know. Visit www.venkatcenter.com. Thank you. Good day.